Welcome back. In this video, we'll focus on group discussions, where we'll share strategies and experiences for managing depression globally. Depression is a universal health challenge, but the approach to treating it can differ based on cultural, geographical, and economic factors. As healthcare providers, it's essential to recognize the various ways in which depression is managed across different regions, so we can learn from each other and develop better strategies for global mental health care. Let's begin by considering how depression is managed in different parts of the world. 1. Low-income countries. In many low-income countries, access to mental health services is limited due to resource constraints. Mental health professionals are often in short supply, and stigma surrounding mental health can prevent individuals from seeking help. However, community health workers, primary care providers, and task-shifting models are often employed to bridge the gap. For example, in rural parts of Africa, task shifting allows non-specialist healthcare providers to screen for depression, provide basic counseling, and prescribe medication. By training general practitioners and community health workers, we can increase the reach of mental health care without requiring specialized resources. In these settings, community-based support, such as family involvement and spiritual leaders, can play a significant role in managing depression, even if formal therapy or medications are unavailable. Reflection questions. How can task shifting be utilized effectively in low-income countries to address depression? What role does community-based support play in depression care in areas with limited resources? 2. High-income countries. In high-income countries, mental health services are more accessible, but challenges still exist. For instance, mental health care is often fragmented, and long wait times for therapy can delay treatment. Additionally, there is still a significant stigma around depression, despite greater awareness. One of the strategies being implemented in high-income countries is the use of integrated care models, where mental health services are provided alongside primary care. This model allows for earlier screening and intervention, helping to address depression at its onset, before it becomes more severe. Telemedicine has also become increasingly important in high-income countries, especially during the COVID-19 pandemic, as it provides a convenient way to access mental health professionals remotely, reducing barriers to care such as travel or work schedules. Reflection questions. How can integrated care models improve early detection and treatment of depression in high-income countries? What are the benefits and challenges of using telemedicine for mental health care? 3. Cultural considerations and approaches. Culture plays a major role in how depression is viewed and treated across the globe. In some cultures, mental health issues are heavily stigmatized, and people may be more likely to seek help from spiritual or traditional healers rather than medical professionals. For example, in many Asian cultures, depression is often seen as a private issue, and individuals may be reluctant to seek help due to the fear of shame. Instead, family members or spiritual leaders may step in to provide guidance. In such cases, it's crucial for mental health professionals to work alongside community leaders to provide culturally sensitive care. On the other hand, in many Western societies, mental health care is generally more accessible, but there may still be barriers to care due to economic disparities or lack of awareness about the importance of mental health. In these regions, public health campaigns and education programs are vital for reducing stigma and promoting the importance of mental health care. Reflection questions. How can healthcare providers offer culturally sensitive care when working with patients from diverse cultural backgrounds? What are some ways to reduce stigma and promote awareness of mental health in cultures where mental health is considered taboo? 4. Addressing global disparities. While depression is a global issue, the disparities in care are significant. In developed countries, there is generally better access to mental health resources, but the challenge lies in addressing the diverse needs of different populations. In low-resource countries, the challenge is in increasing access to care while addressing cultural beliefs and stigma that may prevent people from seeking help. Efforts like the MH-GAP program, developed by the World Health Organization, WHO, aim to standardize care and ensure that depression can be managed effectively in low-resource settings, without requiring specialized mental health professionals. This includes training primary care providers, using screening tools like the PHQ-9, and incorporating community-based interventions. Reflection questions. How can global initiatives, like the MH-GAP program, help improve access to depression care in low-resource countries? What strategies can be used to bridge the gap in mental health care between high-income and low-income countries? In conclusion, managing depression on a global scale requires a multifaceted approach that takes into account cultural differences, economic factors, and healthcare access. By sharing strategies and learning from each other, we can develop effective, culturally sensitive interventions to treat depression worldwide. Each region faces its own unique challenges, but by working together and focusing on collaboration, we can improve global mental health and ensure that everyone has access to the care they need. In the next video, we'll dive into interactive Q&A, where we'll discuss the specific challenges faced in different regions and how healthcare systems can overcome them. Let's keep it going, and I'll see you in the next one.